Some tech for your heart. Welcome back to Techstination. I'm Fred Fishkin. With us is the founder and chief medical officer of AliveCor, ALIVECOR, maker of KardiaMobile, Dr. David Albert. Hi, Dr. Dave.
Hey Fred, nice to meet you.
A
Nice to be
pleasure to
here.
meet, pleasure to meet you. You are a physician and inventor and known for about 15 years now, I think, for KardiaMobile devices. We'll be getting into what's new, but tell us more about the backstory.
Well, the backstory is that I've been a medical inventor and entrepreneur for now about 35 years. And in the mid 90s, I came up with an idea that portable computing, this is the era of the Palm Pilot. Many people probably listening don't remember the Palm Pilot.
I
But
do.
that and we had cell phones, but they were pretty big at the time, that those technologies would merge and would enable us to monitor patients and have them be directly connected to their physicians anywhere. Well, we couldn't do it at the time in about 1995, the early internet, things were not well developed. And then in 2007, Steve Jobs famously introduced the iPhone. And a couple of years later, we could develop apps. And I saw an opportunity to finally realize a vision I'd had when the technology caught up with my idea. And so the result of that was the Cardia line of products, and millions of people and devices later, I think we've had a little bit of an impact.
And you took time away from medical school to study engineering?
Yeah, I did. I was only 8 months away from finishing medical school at Duke when, due to a combination of circumstances, I figured I needed to go and learn how all this technology that physicians use every day actually worked, so that I could build my own. And so I took 2.5 years leave of absence, finally went back and finished medical school. I went to the biomedical engineering graduate school at Duke, and came out uh, an inventor. And so went back and have been inventing ever since. Got my first patent in 1983. It's also the first year I published a paper. I've got 100 patents and about 150 academic papers since then, and still enjoy coming up with new ideas to this day.
I'll go even further back. I bet you were a really curious kid.
Well, I was, yeah, I was into experiments. So I had a science fair project where I took spiders and put them in, if anybody remembers Estes rockets, and I had my control spiders, which I put into a little glass jar. And then I had the same species, because I hunted around my house and garage and places to get spiders. And I shot them up in the rockets, brought them back down and put them into jars, and saw which ones could make webs. Well, the ones I shot into space, or, up 500,000 feet, they didn't like to make webs after that. I think I discombobulated their nervous system. And we probably do the same thing to all our astronauts. I don't think I'd want them to do IQ tests as soon as we launch them.
That's really interesting. So you were doing web in the cloud before any other companies.
Exactly. Web in the cloud. That's exactly right, Fred.
So Cardia Mobile is so easy to use, and I think that really is part of the secret sauce here. Give us the description.
Well, the good news is it'll work with any smartphone or tablet. And then all you do is just put your fingers on it. It automatically turns on and begins recording your ECG in the app. And now, when I first came out with it in about 2011, people said, well, there's nobody who needs it, i.e., senior citizens like maybe you and me, Fred, who has a smartphone, or there are very few. But today, I'm a grandparent. Every day I get pictures of my grandkids on my phone. I do my banking. I do my, Uber and all these things. So I guess it's the old notion of skate to where the puck's going, don't skate to the puck. And so I saw, whether it's portable computing and wireless communication, that's where the world was going, and at least I guessed right on that one.
Sure did. So let's bring things up to date and a little bit about how KardiaMobile has evolved because you really have.
Yeah, we now have a whole product line, not just one product. KardiaMobile is what we're best known for, but we have a credit card side device called KardiaMobile Card. We have one that does 6 leads of ECG called the KardiaMobile 6L. And then we have a new product that's while at first it's focused on medical professionals, so the Cardia 12L, like a 12 lead ECG somebody would get in a hospital or doctor's office. Ultimately, that technology will find its way to the home as more and more patients will not be in the hospital, but will be cared for at home. And we call that, there's a big program called Hospital at Home. And so we're focused on democratizing care, democratizing medical information. And I think that's a trend that everybody is embracing with all the wearables, the Auras, the Whoops, the Fitbits, et cetera. And so, we fit in, but we're a little more medical than most of those devices. And we send our data in many instances, show it to the patient, but send it to their doctor so that if there's something needs to be done, it can be done quickly.
And the data that you have with millions of EKGs and tell us about that and the medical research value, what you're
Well,
learning.
we were very involved. We have over 250 peer-reviewed publications about Cardia devices, and we have about 350 million recordings that have been done with our devices over the last 15 years. And we get over a million every week into our cloud. And that data is used not only to develop AI, term we can't get away from today, but to build on publications and new applications for patients. For instance, in combination with one of our partners, Mayo Clinic, full disclosure, an investor in my company in AliveCor, will be will have capability of doing what they call an ECG age, where it looks at your cardiac age using the ECG from a cardia, and that's a metric that can be modified. You can make your age older by not taking care of yourself, or you can make it younger by taking care of yourself. So we look forward to introducing new functions, AI-driven functions, based on all the data we're acquiring.
And AI can help to digest all of this data, these millions.
It has to, because doctors cannot, there are a lot of people who are scared of all these wearables, all this home generated, personal generated data, and that doctors have 15 minutes to see you and understand your problems and decide on a new path with you, a new treatment path. And the fact is, we're going to have AI to be our medical assistants to help us turn all this tsunami of data into actionable insights that can help people be better.
And perhaps find conditions sooner and enable act.
Absolutely. Well, and predict. So there are a number of AI tools now that are looking to predict problems. And in medicine, prediction means prevention. So if we can find something early, we can prevent a bad outcome. And so we're very excited about those opportunities and bringing those to people around the world.
For consumers, as you know, that everybody's jumping on this. There are smart watches that offer heart rate monitoring. Some have the ECG capability, I think. And what do you offer that they don't or maybe can't at this stage?
Well, we have, a product line that has much more sophisticated devices than the smartwatch or the bracelets or the rings that are really aimed at your heart function. And so we've got, like I said, a lot of papers talking about the clinical applications, and we have more sophisticated algorithms and AI really aimed at patients. So we have, while we sell directly to consumers, and you can buy our product Amazon and in retail places like CVS, we connect those with organizations like the Mayo Clinic and your doctor, your hospital, in order to give them early insights into things that a smartwatch can't do.
Tell me about the customer base today. You got some wonderful ads running. Are these just for people with heart issues?
No, first of all, heart disease is the number one killer, remains the number one killer. We've made great progress over the last 50 years, but it's still the number one killer and more than all cancers put together. And I think what we want is we want people to recognize risk early. If you have a family member who has what we call a family history of heart disease, that you become vigilant and monitoring your heart health long before you become a heart health age person like me. Okay, I'm 71. I'm in the heart health age. I had family history, so I've been well aware and been monitoring my heart health. We want people to begin doing that, whether it's their ECG or their blood pressure, at a young age, so that, as you said, we can see something happening early on and help you address that and ultimately have better outcomes and prevent bad outcomes.
I'm sure you have some wonderful stories from customers who've made use of your devices.
We do. We have literally thousands of people who've messaged us, emailed us, thanking us. And I could relate some of them, but to have somebody say, "You saved my life, my father's life, my grandfather's life." I don't know that we've saved anybody's life, but what I know is we've helped them. And one of the major pieces, because anxiety is a major component of our rapid lives these days, is bringing somebody peace of mind. They may have a heart issue, and they think, "Oh, am I suffering from it right now? Am I having a spell?" And then the KardiaMobile allows them to say, "No, I'm okay." Peace of mind. And we hear that time and time again.
Or on the other side of the coin, maybe get some help when it's needed. Right?
Oh, absolutely. And we've done that many times. I've got many stories, both from customers who are patients and also from doctors about patients who've benefited and been directed to the appropriate care with one of our devices.
Any thoughts about what's next in this new age of digital health? I mean, we talked about AI just a little bit.
Well, I think that it certainly will involve AI. It will involve predicting, again, as we said it, predicting things that in the future and then heading them off at the pass. We have to get better if we're going to decrease the costs of healthcare, the complexity of healthcare. We need to start addressing things like lifestyle and your risk factors at an earlier age. And so I think that's where digital health can have a great role, is helping people identify their issues and start to address them. And it also, with AI, help the caregivers better inform and better treat their patients. So I see that as critical and one of the critical contributions of digital health.
Well, congratulations to you and the whole team there. The site is kardia.com, KARDIA.com. Dr. Dave, thank you so much for spending time with us.
Fred, thank you for inviting me, and I hope this brings some benefits to your audience.
The Haven 10,000 lantern is a smartly designed, beautiful solar light that you will love indoors or out. It is waterproof with up to 1,200 lumens of brightness. That's a lot of light. And the base becomes a flashlight at the push of a button. The power comes from a built-in lithium-ion battery recharged by the sun. The solar panel is built in, or USB-C. The battery can even recharge your phone. Did we mention how durable it is? How it folds down and can run for up to 120 hours on a charge? But the real power of the Haven Lantern comes from the people behind it and their mission to provide this quality lighting to those in the world who need it most, including in disaster emergencies. Your purchase helps to fund those efforts, and if you use the code TEXTINATION20, you'll get it at a 20% discount. That's TEXTINATION20 at havenlantern.com. Create your haven.